All right, folks, it's that time to answer some common health questions. And joining us is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you so much for coming in today.
Good to see you, Keely.
Good to see you, too. Well, here's the first question. This has kind of been in the news recently. We've been reporting on this. A case of whooping cough has been reported. So what are the signs of whooping cough, or pertussis, as it's called, and how dangerous can it be?
Yeah, you don't hear much about this anymore until we have some kind of an outbreak. And, it's been around for a long time. It's from Bordetella pertussis. And before the vaccination, we used to see over 250,000 or so cases every year with up to 10,000 deaths. After the vaccine, tremendous vaccine, now we only see maybe 10,000 cases with about 18 deaths over the past several years. The way you tell that it's pertussis is sometimes kind of difficult. In the first week, symptoms can be very similar to a cold: cough, sneezing, achiness, things like that. About a week in, you get the pathognomonic type symptom of the coughing paroxysm, where you get these severe bouts of coughing that are worse at night. Those can linger about 2 to 3 weeks. The treatment is antibiotics, unlike a cold, which of course doesn't help. The type of antibiotics are either a macrolide like azithromycin or a sulfa drug. And the reason why we treat it, it goes away on its own, but the reason why we treat it is because one of the complications can be pneumonia, which is what in certain patients can be fatal. So beware. You don't need it right away. You don't need the test, that is, to treat or to test for it right away, only if you develop those symptoms within a week or two after having a cold.
All right, it's cold and flu season, so this leads us into our next question. When should you stay home from work? When you're coughing, or when you have a fever, or both?
Yeah. Well, for some of us, it can be a tough decision. You got the cough, the congestion, you feel a little bit achy, you have a fever. You don't really want to spread it to your coworkers, but you also don't necessarily want to take a sick day. Well, there's actually findings of a recent study that looked at this and said that you cost more to your employer in lost productivity and the risk of transmission to your coworkers than if you were to take the sick day off in the first place. Up to 60% more. So that kind of gives you at least a little bit of a gauge as to what to look for. But as a general rule, of course, it depends on what you do and where you go to work. There's a general rule, number one: if you have a fever greater than 100, if you are drowsy or achy and feeling that way and you know you're not going to be productive, take the day off. If you're needing to take medications that make you drowsy, take the day off. And then most importantly, if you have a cough or a lot of congestion or secretions of which you're coughing, obviously you can spread it by touching your desk, doorknobs. Take the day off because your risk of transmitting to your coworkers is great. Make sure you stay home, especially in the first 24 to 48 hours when you're most contagious.
Because of course that loses the company money if everybody else gets sick.
And that's important as a good employee.
It's just bad when you get sick on a Friday, because then everybody thinks you're faking it.
You get sick on a Friday, right?
Thanks a lot, Dr. Soria. And if you have a question for Dr. Soria, you can send it in by going to our website, WPTV.com, and clicking on the help link. Scroll down on the right-hand side, and that is where you'll see the form to write in your question. Once again, thanks as always for coming in. We'll see you next week. Hopefully, are you on vacation?
No, vacation.
All right. We'll see you next week, and we'll see